Hello everyone, we welcome you to Health and Family. Let me preface my introduction by saying what I'm about to say is to no one in particular except to make a valid point. So picture this with me. Any average day of the week, you're getting ready for work, you get on a bike or car, and your focus is getting to work, when all of a sudden you're involved in a horrific traffic accident. Your life as you know it has now permanently changed. However, the ins and outs of life have not changed. You are still expected to maneuver as you did prior to the accident. But it is not that simple. And with that, we highlight the accessibility factor with our guest, Mr. Keith Simmons, Accessibility Officer from the Ministry of Health. In addition, we have Ms. Vanessa Daniel, who is an architect who at times has focused in on accessibility features to assist individuals who are in need of her services. We welcome both of you to Health and Family.
Thank you.
And it has been a while, Mr. Simmons, but we are here. So I wanted to start off with Mr. Simmons. You are with the Ministry of Health.
Yes, at Aging and Disability Services.
Okay. So talk to us about, I said organization, but it's not necessarily an organization. It's a department more so?
We're actually not a department. We're a section within the Ministry of Health.
Okay.
And we consist of a manager, Ms. CITV Bermuda, who is also the Elder Abuse Registrar.
Okay.
We have Ms. Smith Burgess, who is coordinator for seniors and persons with disabilities. We have two case managers, Ms. Heidi Mori and Mrs. Shay Smith, and also Mrs. Jakia Berlin, who's the administrative assistant.
All right. So why do we have, well, let me start with, when was this department established, the section?
Originally, the office was the National Office for Seniors and Physically Challenged, which was put together in 2001 by then Dame Jennifer Smith and the Honorable Nelson Bascom, trying to put an organization together to make it a one-stop shop for seniors and persons with disabilities.
And so it's been like that since?
Yeah, not totally a one-stop shop, but we do cover. And then we had a name change in 2014, 15.
Okay.
Yeah.
All right. And so in your opinion, is it necessary to have this type of department?
Yes, persons in our communities need somewhere to go for resource and assistance. Like we have 4 pillars: education, advocacy, case management, and compliance. Okay. So we try to educate the community about seniors and persons with disabilities. And then also on the other side, we also advocate for them of what they might require to try to live a normal life as possible. Then our case managers will come into play and help with housing, financial assistance, or different things like that. And then a lot of, where I work also, we do a lot of compliance to ensure that building codes, people meet the building codes, and then also the restrooms are up to code compliance for care of seniors, and any other legislation that comes under us to see if everyone is up to compliance with that.
So can I say you do a lot of advocacy on behalf of disabled individuals and the elderly? And let me just stop by saying it really is needed, because I see this each and every day. I work in schools and I see how this is so needed. Let me bring in Miss Vanessa. How are you?
Good, thank you. Thank you for having me as well.
You're more than welcomed. So what exactly do you do? I know you're an architect, but how does that relate to the accessibility factor?
Sure. So I also sit on the IBA Council, which is the Architects Council. And we do a lot of education and promoting awareness, especially in conjunction with Keith. But where architects in particular are best poised is when we advise clients on accessibility design and barrier-free design. And when I say accessibility, I don't just mean for people in wheelchairs. It's I prefer to use the term differently abled, because we all experience different levels of mobility throughout our lives, from when we're very small to when we're very old.
Well, since you're giving me a new term, I'll stick with that. So how do we define differently abled? Keith.
Oh, really? We have persons that are physically challenged or have mental challenges.
Yes.
And Mid-Atlantic Wellness Institute deals with the mental part about it. And we have, and also a lot of cognitive and also they say intellectual challenge that we like to address. Just like you wear glasses and contacts.
I do
Take
wear
them from you,
glasses.
how well can you see? That's a disability.
Not very well. I'm really suffering. So, is that an example of someone
That's
with
an
that?
example of- yeah.
So
That's
that's the
sort of
majority of us then
easy, yeah.
have our disability to a certain extent,
Yeah,
differently
we're
able.
actually waiting for the last census to come out, but in the 2010 census, persons with what they call correctors or vision impairments
Yeah.
were actually on the top of the list in the census for disability.
Wow.
They're
Wow.
blind, no vision, and things like that.
And then there's the hidden disabilities
Yeah,
or
lots
different-
of hidden disabilities.
people with arthritis,
Heart condition.
heart conditions,
conditions,
diabetes.
hidden, yeah.
Yeah.
Alrighty. So, talk to us about some of the issues that you deal with.
I find that there are three main issues that I deal with on, maybe not day to day, but on a regular basis. And that would be changing the mindset of people. So, for example, we were talking about changing the terminology about differently abled as opposed to disabled. And empathy, of course. A lot of people, architects, builders too, not just the general public, I find that there's a lack of empathy and understanding how a user uses a space, how they maneuver within a space. And I feel that we all need to be a little bit more proactive in thinking about how other people use spaces. And then the last is what I call perceived cost, because a lot of people think that it's going to cost a lot of money to renovate their home or renovate their business, when in fact it doesn't. And the planning department of Planning, they actually will waive the cost if you are going to be making changes to your building. So that cost is waived right there. And then when I say perceived cost, I mean, think about the bigger picture. If you are providing access to your building, for example, for everyone, then you're increasing the number of people who are coming to your building.
Yeah, I wish people could see it like that.
We
Yeah.
get a lot of pushback because a lot of people doesn't want their premises to look like a hospital.
Right.
So what we have nowadays, we promote universal design.
Yes.
There's lots and lots of products that you would not think that are usable for everyone.
Right.
And they're very, very fashionable. Very fashionable.
Give me an example.
Like nowadays, you can buy grab rails and install that are brush coated, marble finished, granite finish, things like that are very fashionable. That Talkers Point, we went in there a couple of years ago for them and done an assessment, and the restrooms in the lobbies
Yes.
and different other walking areas on handrails on the stairs. Took off the old-fashioned handrails, put in some very fashionable marble finish and coated with gold or copper, things like that. Really pretty. I mean, people saw me, they were like, okay, yeah, we can do this.
And people don't even notice it when it's at that
When
point.
it's
Yeah.
good design, people don't notice.
Yeah.
I think about my favorite knife in the kitchen, for example. It's a Good Grips, and it was designed for somebody with arthritis. But it fits perfectly in the palm of my hand. I can put my thumb to grip it nicely. And I think about the old regular handle knives that can slip out, but the Good Grips, I'm using that knife every single day. And that was for someone with who was differently able.
Differently
Like ramping your building, we always try to tell people time is money. Ramping your building, when you have movers coming in and out quite often, they can deliver faster, in and out faster when using trolleys versus up and down steps. And also, you're saving someone's back. It's the physical things that can happen. Lifting quite heavy
Without-
furniture,
yes,
things
yes,
like
yes.
that.
Yeah, I
You
kind
know?
of feel bad for some of our ladies here, our techs, and they do have to do
But
all
I
the
noticed-
lifting.
Yeah, this morning putting this set together, it's something to think about.
Yeah. So I wanted us to look at the Bermuda Trust buildings, right? Some of those are beautiful buildings. We're trying to preserve them. And yet, are you allowed to make these changes to these buildings?
But a protected building list is like a grade 1, 2, and 3. It can be done. There is a lot of pushback at times from various committees or different members of the public.
Right.
If they could do it in Greece for the Olympics, we can do it here in Bermuda
Okay.
without touching the aesthetic view of the building. It can be done.
I can also let you know,
Sure.
Masterworks, for example, that I worked on that one quite a few years ago,
Right.
over 10 years ago. And we upgraded it, so it's a public building, so it's accessible.
Right.
There's ramps, they're integrated into the design, so you don't even necessarily notice that they are there, but they are. And that was a listed building, so it is possible. And in a way, we're lucky in Bermuda because there's an understanding, there's a little bit of flexibility. The Department of Planning will work with you in helping encourage accessible design.
A lot of times it doesn't need to be exactly to code,
Right.
but we can refer and defer in areas. Like a proper ramp should be 1 in 12. For every inch rise, there should be 12 inches in length. Sometimes we'll do a 1 in 11 or 1 in 10. Try not to make it too steep, but make it workable.
Yeah.
And we do things like that.
It's interesting that you're talking about ramps because I notice a lot of people that are not necessarily differently abled, they utilize the ramps as well. So they may not have necessarily known it was for individuals in a wheelchair or something, but they also use it. Yes, it does.
If you go, we've done a survey in 2 areas, one in the Washington Mall by Delta, and one we were across the road by shopping center, Bermuda Telephone Company building, which is now One Communications. A lot of persons coming from the west at One Communications will go right up the ramp. A lot coming from the east will go right past the steps and up the ramp. And we stood by shopping center for like an hour, and we just ticked the boxes. And then we were down by Delta and Washington Mall and just watched everyone negotiate the steps or the ramp.
Right. It's
The
usually
ramp out, the ramp
It's a
out
lot
with
easier.
everybody. So ramps work.
All right, we're about to go to a break, but Vanessa, if I can ask you, is there a parish, I know it's kind of a biased question, is there a parish in Bermuda that's more prone to injuries than another? Don't say St. George's.
I was going to say it's got to be Sands, right? This time of year, we got to say it's Somerset, not
It is
St. George's.
Somerset?
No, it's not. I love that question. I have no idea. I would love to find out. That's such an interesting question.
something to do
If I
later
had
on.
to make a guess, though, possibly the number of injuries per capita maybe in the city of Hamilton because there's more public buildings and more density, but maybe we need to find out.
That's something to
You
investigate.
can get a lot of slip and fall injuries because a lot of designers, not knocking them, people like to have fashionable stuff.
Right.
And if you look at a lot of floors in buildings sometimes, they can become very dangerous because of the surface, the texture, the finish,
Yes.
very slippery.
No, I think,
And a lot of them don't take that into account sometimes.
Yeah.
Very, very slippery. So you might go in another day, it's nice and dry, sunny. You get some rain and people out on the sidewalks, walking into the building, the shoes are wet,
Yeah.
and zoom,
Slip.
gone.
Alrighty, that's food for thought. When we come back, we're going to talk about one of my favorite shows, which is House Hunters, and I'm going to ask Vanessa a question as to why certain ways the program was done. This particular program I watched, so let's stay tuned. We're going to take a break, and we'll continue the conversation, this interesting conversation with Mr. Keith Simmons and Miss Vanessa Daniels. Stay tuned.
Healthy people in healthy communities.
The barriers people with disabilities face begin with people's attitudes. Disability is only one part of the person. Look beyond the disability and see someone who goes to work, has a family, does laundry, gets angry, cries, laughs, and dreams like everyone else. Awareness, the first step towards change. This is a message from the Department of Health.
And we welcome you back. A lot of information has been talked about regarding accessibility on the island. And we're happy to have with us today Mr. Keith Simmons and Miss Vanessa Daniel. So when we were about to go to the break, we talked about House Hunters, which is a show I kind of watch like every day. And one of the programs that I watched, it was a young lady who was in a wheelchair. And you know, most people talk about they want that open floor plan, am I right? And so this young lady was like, no, I really want it closed, so that, because she was using the walls as her guide, and I just wanted you to elaborate on that if you could.
Sure. So, I mean, every person is different, and how they use the space, especially residences, it's sort of catered to their own needs. I unfortunately did not catch that show. I love House Hunters too. Possibly, she wanted to be able to have for stability, so that even if she is in a wheelchair, so that she has that comfort of being able to, if something were to go wrong, that there's something on either side.
Right.
Imagine if the chair fell over, and you know, so there's.
Plus helpful for someone that's visually impaired.
I was just thinking of that
because the house.
Yeah, I wanted to come back to you, Mr. Simmons. How many people in Bermuda would you consider to be actually
Right now, it's just over 4,000 people.
differently abled?
Yeah,
Okay,
definitely, yeah.
all right, and so
And that's a laundry list. It varies.
obviously different
Physical
accessibility.
disabilities,
Yes.
mental disabilities, terminal illnesses, like they've put diabetes in there now, cancers,
Yes.
different things like that. It's a whole laundry list now.
And that doesn't even include the ones who've gone overseas and might live overseas.
Right. So let's be candid and talk about the accessibility here in Bermuda. I've been home about 25 years, and I've seen a few changes. In your estimation,
I like to look at the built environment and trying to make it friendly from birth to death. So from someone, a new mother with a newborn,
Yes.
using a stroller,
right?
to move about, to someone that ages on the way, unfortunately, time. And there was a World Health Organization program of age-friendly communities, and that's something that we like to follow, because government is looking at aging in place, keeping someone in home as long as possible,
Yes,
and caring for them in their home.
Yeah, we did a program.
So we would like to get people to think, when they buy houses or build houses or renovate, think about you aging.
That's
So
a good
make
question.
your
Yes.
home as friendly as possible, and it can be very fashionable.
Right.
So you don't have to worry about looking like that hospital.
We're
And
going-
also in the cities and things like that, trying to work with corporation on sidewalks and finishes, and textures, curb cuts, renovations to buildings, entrances, all of that we try to work on a daily basis.
We're going through that a little bit right now with a client, husband and wife. Kids have gone off to school, they've got their careers now, and they've moved out. So the husband and wife are empty nesters. In their 50s, they realize they're going to be in the home now for at least, hopefully, 25, maybe 30 years. And they're at the point where they've got a little bit of money, so they want to do the renovations now. And we're talking about showers that have no lip, so if and when they ever are in a wheelchair, they can just glide right in. So it's like a
saw
frameless
that, yeah.
frameless shower. We've also been
That's
talking
nice,
about
yeah.
in the kitchen drawers that pop up, as opposed to, so they don't have to bend over as much for the back.
It's just little things
Little
that
thing-
make a difference.
exactly.
Pull out pantries and things like that are, one time ago they were special order, now they're all part of a kitchen fixture.
Okay. I wanted to talk, we're talking about buildings and apartments and so forth. Are landlords required to make these adjustments?
New buildings, new apartment complexes, 1 in 5. The 5th one has to be accessible, or have accessible features.
And so, like in the shower, you would have the bar,
The complete
the
apartment,
complete, okay.
really, shower. A lot of people are building nowadays separate soaking tub and shower, walk-in and really and shower, things like that. Hallway widths, door widths. Like if I was to build a house right now, even if I was able-bodied, I would put all my doors 3-foot doors through the whole house.
Yeah.
And you wouldn't have to change them later, because you have someone ages with a cane
Right.
or with a walker trying to negotiate going through the doorway.
And the
Things
older
like that.
homes were not designed that way,
A
were
lot of
they?
older homes just got 2'6" doors,
So-
2'8" doors.
I wanted to go judicial if I could. So if these adjustments are not made, can a renter have a recourse with our judicial system? Has that ever happened?
The residential code does not call for a homeowner to make the home accessible or to have accessible features. The commercial code does.
Commercial meaning businesses and so
Businesses
forth.
and things like that.
For yeah, definitely for new buildings. For renovated buildings, it's encouraged. It's not necessarily enforced.
Actual fact, the building codes are being reviewed at present, and we're going to go through the code. Like right now, we're governed by the International Building Code, the IBC, and we're going to take a lot of that and make it Bermudianized.
Yeah,
We have to. Bermuda's a lot different from the U.S., so
Right.
we have to Bermudanize it.
And
A lot of
what would that
our-
entail?
Our terrain is very hilly and
Right.
things like that.
Right.
And a lot of things that might work in the U.S. doesn't work in Bermuda.
Yeah, that's-
so we have to make it
And
Bermuda friendly.
In the building code right now, too, I've got a copy of the residential building code from a couple of years ago when it was upgraded. There's a whole, and it's a significant chapter, and it's a guideline for upgrading for accessibility.
Right. So it's an option that you have. And we're trying to get people to do that, encourage that.
Right.
And maybe if we can get the Department of Planning or Ministry of Finance, if they can do some sort of free building permits or the applications, if someone does come in with an accessible feature
Right.
or adds accessibility to their home, they can get a building permit free or something like that.
Is there buy-in from the businesses regarding accessibility?
Some are. Some do call our offices come quite often and have us to come in and do assessments of their premises. So we just not do accessible the doorway and things like that, but
It's a lot
we'll
more.
do the corridors, do the aisles, because a lot of times people end up putting boxes in aisles and things like that. And I'll take my chair and move furniture quite often because
Right.
they don't think it's also a fire hazard.
Yeah,
Something goes wrong or whatever, people trying to get out of the building, they get stuck.
We recently did a jewelry store. They were moving to a new location, an existing older building. Obviously, there were some elements that could not. For example, the bathroom's up 7 steps, and there just wasn't the space to put in a ramp or even a chairlift. But that's for the staff anyhow. But for her clients and her father in particular, he's in a wheelchair. She wanted him to be able to come to her store. So it was very important to her to have an accessible through the front entryway, and then also so he could come around to the back to see her in her office. And then that built on to, well, she realizes that a lot of her clients are mothers with strollers, and that just helps them come as well.
Exactly.
We have a lot of new mothers that make comments to us all the time. Keep up the fight. I didn't realize it was so difficult until I had my baby. And they go around Hamilton trying to access stores.
Yeah, I was actually thinking
And
on
they're
a plane.
I
the
didn't
other day.
realize that 4-inch step makes a difference.
Wow.
The 3-inch step makes a difference. Before I used to just run in and out, and I gotta lift this stroller. It's
So,
amazing.
Mr. Simmons, excuse me, Mr. Simmons. So if someone feels discriminated against for a disability, do they call you, first of all? You're
Some call our office and we direct them to the Human Rights Commission.
okay.
There is a part of the Human Rights Act for discrimination against persons with disabilities. They are protected under the Act.
But
so-
have you been involved in anything? I don't get too personal, but.
I have been involved in a couple.
Okay,
so
and that's where you want to leave it. Okay,
I'm
not a
gonna
problem.
leave it at that.
Alrighty. So, what advice would you give to somebody who feels that their rights are being trampled on, Vanessa?
Okay. Go
Yeah,
ahead.
I was just going to say, I would definitely defer to Keith and say, listen, as a starting point, speak with Keith or the Human Rights Commission, because we're here to help for barrier-free design and accessible design. But
Yeah, we'll
Yeah,
look at it in our
definitely.
office and take notes and look at it. We've had clients come in. Actual fact, we've had people call the office where the actual person doesn't want to make that complaint, but they'll call the office and we'll look at it
On
and
your
we'll take it up.
on
And then
their
we'll go,
behalf.
yeah, we'll call the Human Rights Commission. There's a great staff at Human Rights Commission, and we'll sit down and talk it over with them and see what they think about it, and then say, yeah, well, let's try to call the person in, get them to come in, and we'll try to work on it and do something about it.
Yeah, we're actually going to be interviewing them pretty soon. A few more minutes left of the program. Went really fast, I know. I wanted us to talk about transportation, public transportation in Bermuda. And the reason why is I've been to many different jurisdictions where the public transportation really, really works for some of the folks that may be in wheelchairs.
Some jurisdictions do have great public
They
transportation.
really do. And so
Some
what,
areas
what's,
that I've traveled to really great.
Yeah.
Bermuda, our ferries are really, really nice, really accessible. Mm-hmm. Be glad when they finish the new dock in St. George, so that
It's finished.
we can
Oh.
travel to St. George. It's not completed yet.
Oh,
no.
okay.
But the thing is, getting to the ferries. There are some buses that do have ramps. They were brought in some years ago primarily just to take the tourists from Dockyard to Horseshoe Bay, but they ended up using them on the regular routes. The problem is our bus system, the infrastructure, will have to be changed. As you know, a lot of our bus stops are on the side of the road, just a pole on the side of the road. No good. It's not going to
No.
work. Even some of our lay-bys are not wide enough. So the whole infrastructure needs to be looked at, and it's going to take a few million to do it. the buses.
I think
So
you're
it's
being
gonna-
kind.
So it's going to take a time to do that, but the new government, give them time. In their manifesto, they did have a sentence there about a transportation system for physically challenged persons. So
Okay.
we'll see where that goes, and by that I have some ideas on how that could work.
All right. Well, I know your input will be appreciated.
It's something that can be done in Bermuda. It's going to be a bit costly, first course, but after that, just operating course. And it's something can be done. There's a number of persons out there that need the
And
transportation.
an aging population.
And yeah, and our population is so aging. So
Yeah.
So
something
does
has
the
to be
bus
done.
actually go down to
We
accommodate
do
people?
have kneeling buses at the
Okay.
present, where they can stop at the bus stop. They will kneel, so you don't have to step up or step down as high.
Right.
So they are quite handy, I tell you.
Okay. All righty. Any final words? Unfortunately, we only have about a minute left. This is a very interesting conversation.
Accessibility, I would just like to see it's an everyday fight. It is changing. We are growing. It's slow, but still a lot of work to be done.
I just have to say, Keith's been a godsend too. When I came back from doing my master's degree, I really wanted to start focusing more on helping with accessibility. And Keith's, he's perfect. He's there. He's all the time there, always giving advice, and always an advocate.
Give me your phone numbers again so that if people want to get in touch with you, Mr. Simmons.
My direct line in the office is 278-6525. I'm available for any questions you may have.
And mine's 516-6119.
Say it again, 51.
516-6119.
All righty. Big thanks to both of you.
Thank you.
All righty. We really want to thank our guests today, Mr. Keith Simmons and Miss Vanessa Daniels. This is a matter that we must all take seriously. While some may say this does not apply to me, please know that life has a way of changing in a blink of an eye. So let's start to show consideration to our fellow brothers and sisters who may not be able to maneuver as freely as we can. I'm Shay Burgess. Thanks for joining us.